Welcome, everybody. Very excited to talk to you today. I'm Dr. Joan LaRovere. I'm co-founder and president of Virtue Foundation. And I'm here with Nicholas Duard, our lead data scientist, and Michael Burke from Databricks to talk about the Virtue Foundation and our VF Match platform and the collaborative work that we've been doing. I'm going to start with a brief video that I think highlights this work. Virtue Foundation delivers clinical care and uses data science for good to impact global health and bring care to millions of people across the globe. What we're trying to do is continually refresh our foundational data set, how to create those mini knowledge graphs around each hospital, around each healthcare NGO. I think that is one of the most fundamental things that Databricks is assisting us with today. For the past 15 years, really under the vision of Dr. Abby Elahi, who I co-lead the Actionable Data Initiative with, we have been focusing on building an AI platform for global health. By being able to understand the situation on the ground, where are the hospitals and healthcare NGOs? What is the work that they're actually doing? We're able to take that data and match it up to the clinicians who actually can deliver at that specialist level. There's currently 143 million patients every year waiting for surgery in low and middle income countries. It's a really large problem. But if you can create efficiencies in the data, you're talking about millions of lives. The Databricks GenAI capabilities has allowed us to refresh our foundational data set. I personally do pediatric cardiac intensive care. I want to understand where are opportunities to take care of children and where could I be able to add skill, particularly in the care of complex patients post-operatively after cardiac surgery. Virtue Foundation's delighted to be a founding NGO for Databricks for Good. It's helping us to unlock data to bring impact at scale to millions of lives on the ground. I think that video summarizes well the work that we are doing at the foundation. We're an NGO with special consultative status to the United Nations and have been undertaking medical and surgical expeditions to low and middle income countries for over 20 years. And my colleague, Dr. Elahi, came up with this idea to use data science, machine learning, artificial intelligence 15 years ago. The thought was, we can see on the ground this situation. We should be able to get granular, geospatial, targeted data to better match resource with need in this inefficient market where supply doesn't meet demand. And the issue for us, the use case we were driving towards, was how do we get our medical and surgical teams to the locations with the precisions that they demand? Where does the oculoplastic surgeon go? Where does the cataract surgeon go? Where does the head and neck surgeon go? With over 143 million people waiting for surgery in low and middle income countries every year. The problem is one of a lemon market, and this concept that healthcare philanthropy follows market rules. And in a lemon market, there's asymmetry of information. The physicians, the surgeons that can provide care don't have enough information about where they should go. The NGOs themselves do not know the best locations, and you often spend inordinate time trying to find that match. Those folks that most need care are often the ones who can least make their needs known. So this is the real opportunity that our current era of data science unlocks for us. And when we thought about the philanthropic healthcare interventions, and you think about this market, who are the actors in this market? Well, there are the large-scale, long-term interventions where it's countries, it's governments, it's Gates Foundation. But then there is what we refer to as the domain of the small, those small, agile, speedboat or race car interventions where you're in and out over a week or 2 weeks or 3 weeks. And it's small when you think about it from an individual NGO or team's perspective, but using data science, you can leverage that domain of the small into aggregating all of those different medical and surgical teams. And that's really what we set out to do here. We thought this would be simple, like we could find out where are all the healthcare facilities and who are all the healthcare NGOs. As a UN organization, we went to seek that and found that those data sets didn't really exist. So we had to build them. And that was our first machine learning pipeline, to create our foundational data set of the healthcare facilities and the healthcare nonprofit organizations. Initially, we did it for 24 low-income countries, and we expanded it to the 72 low and lower middle-income countries. We published that with Taylor and Francis in 2 editions in 2020 and 2021. And I think one of the challenges of that is we could use the machine learning to pull down the actual data of the organizations, but there was a lot of human-in-the-loop work, extracting the structured data and information, and we realized we had to leave data behind, structured and unstructured data that's readily available through the web. But when you're using humans as opposed to Gen AI, the time and cost was insurmountable. But we took this initial foundation data set for these facilities and built it out onto the VF Match platform, the first digital marketplace for global health philanthropy. And I think we're going to have Michael discuss a little bit about what we've been doing with Databricks in terms of scaling through generative AI. And then Nicholas is going to discuss with you some of what we've done with our foundational data set and now we're doing with this continually refreshed data in terms of using this to identify medical deserts, to build optimization models about where you open the next healthcare facility or build the next service line, such as cardiac surgery or neurosurgery in existing facilities in low and middle income countries, for example. And matching on our platform using this data coupled with this medical desert information. So I'm just going to pass the microphone to Michael to talk about the work we're doing scaling through generative AI.
All right, thank you, Joan. Really appreciate it. So as Joan alluded to, I'm a resident solutions architect at Databricks, and I've been leading the delivery on the Databricks side. And we're going to be talking a little bit about the Gen AI use case. I'm actually going to sort of forward through a little bit of these slides, but we're going to focus on a very simple example. So here on the screen, we can see all the way on the right, the things that our generative AI are able to populate. So in the top box, we can see suggested updates, and then also in the second box. And then in the bottom area, we can see data that is already present in the foundational data refresh that we will not update. So the question is, how are we actually doing this? Historically, it's been a combination of algorithms and manpower, and we have been doing a lot of this with generative AI. So this information diagram that is probably too small for all of you to see is how we're doing it. And let's go through each piece in turn. The first is web scraping, and thank you to a wonderful partnership with Bright Initiative and Bright Data. We have had first-class web scraping technologies at our fingertips, and they've actually given us an amazing opportunity to have pro bono credits. So we're combining Bright Data web scraping with Overture, which is essentially open source maps. But conceptually, you can augment your data with anything. These are just the 2 things that we've been focusing on recently. All right, next slide. That data needs to come into Databricks so that we can use generative AI on it. This is standard structured streaming with Delta and the tech stack that you'll be bombarded with for the rest of this conference. But we're using the very simple things like Delta and Spark to do a lot of this data engineering to massage the schema into a format that is conducive to generative AI analysis. Next up, we are doing the fancy stuff, the generative AI. And this is highly, highly simplified. If you guys have any questions about it, feel free to come up after the talk. But going through each of these boxes in turn, in the bottom left, we have key information extraction. That is a field of generative AI that we're doing right now. We're converting text documents into structured data. And we're also applying logic with some sort of reasoning aspects so that we can understand some nuances about these fields. So take a very simple example. I have a Facebook page for a website. I want to know the address. All right, that's not too hard. But what if I want to know the medical subspecialties at a very granular level based on arbitrary definitions? That's suddenly really, really challenging. And so that's what we've been iterating on and focusing on for key information extraction. Once we have pretty good results, we put this into a massive post-processing module. So one, country is sometimes a little wonky just due to the nature of our input data. We resolve that. Next, we have medical specialty post-processing. So again, doing all of that extraction about medical specialties in one step is really challenging. So we break it up into both an LLM call and RAG, retrieval augmented generation. In the top right, we can see our confidence score, and that is created via a bunch of collaboration between Databricks and Virtue Foundation, where they have used signals that they used in the past to determine how trustworthy a website is. And this will give it a continuous 0 to 1 score, which helps us tie break different sources with conflicting information. And then finally, for primary key resolution, we have to know that hospital X is hospital X. And not just for our incoming data, but for the existing data set and for all future rows that would correspond to hospital X. This sounds very easy, but it's actually tremendously challenging. So we're using a fancy probabilistic model. The open source implementation is called Splink, and we do that to resolve any entities to a single unique ID. Cool. Now, Gen AI is awesome, it's great, but it's fundamentally non-deterministic, and we're truly pushing it to its limit. So we have also created a human review app. In the middle, we have a Databricks hosted app that we actually just moved over to a bespoke implementation created by the Virtue Foundation engineers. And what we are looking to do is iteratively roll out different good or bad rules. So if we know that some data are subject to a specific criteria, we forward it to the gold layer, which is then upserted into the website. If we know it's bad, we automatically remove it and quarantine it, potentially for later iteration. And that stuff in the middle, that's where we still are going to have humans in the loop. And as time progresses, there will be less and less of that, favoring automation over humans. So I'll pass it over to Nico.
So this foundational data enables a myriad of applications. Here are a couple examples. So high-level questions might resemble this: where to build the next surgical center, or how to best deploy tricycle ambulances. To answer these high-level questions, we derive new insights and effectively data layers. So one of the first applications is trying to figure out where to build new facilities. This is done by combining a lot of broadly available geospatial features with the location of current healthcare facilities, which is an output of the healthcare data refresh built with Databricks. Long story short, this enables us to narrow down, for example, to the top 20 locations in Ghana to build new hospitals that effectively maximize healthcare accessibility, as in maximize the travel time, the delta in travel time from pockets of population to healthcare facilities, and effectively help maximize healthcare access. Another possible application is identifying medical deserts. As a first stage, from the location of current facilities, we can derive travel time to facility maps, factoring in infrastructure information, and then plugging in population density information. We can go from this travel time map to effectively a catchment map, where each healthcare facility has a limited capacity that is run against the surrounding population density. Here in this map, darker greens means a lot of catchments overlapping. Lighter greens means one or two catchments. So we're looking at the regions that are covered in terms of accessibility analysis. And then the big questions becomes, outside of coverage, which regions have a high population density, which regions might be a good target for intervention and development of capacity. And we're looking at those in the darker green color, for example, in northeastern Ghana. Finally, the healthcare data refresh built with Databricks has helped us effectively enhance and further sharpen hotspot boundaries in terms of medical deserts and in terms of covered areas by including facilities not discovered previously and effectively enhancing precision for these insight layers. Thank you so much.